Right, everyone, and it's now 2:30. Thank you for joining NCUI's Project Firstline Application Information Session. My name is Aliyah Smith, and I'm the Public Health Project Assistant with the Project Firstline team at the National Council of Urban Indian Health. Next slide, please. Today's agenda will be the following. We will begin with our welcome and move into the Project Firstline overview and introduction to NCUI's fellowship program, key dates, questions, and lastly, frequently asked questions. Next slide, please. A few housekeeping rules. Please turn on your video, mute your mic, and enter your name in the Fellows case, your college or university that you are currently attending. NCUI is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUI is the only national representative of the 41 Title V UIOs under the IHS and the IHCIA. NCUI strives to improve the health of over 70% of the AIAN population that lives in urban areas, supported by quality, accessible healthcare centers. Next slide, please. And before we go into the other slides, I will read our CDC acknowledgement. Project Firstline is a national collaborative led by the U.S. Centers for Disease Control and Prevention to provide infection control training and education to frontline healthcare workers and public health personnel. NCUI is proud to partner with Project Firstline as supported through Cooperative Agreement CDC RFA OT 18-1802. CDC is an agency within the Department of Health and Human Services. The contents of this program do not necessarily represent the policies of CDC or HHS and should not be considered an endorsement by the federal government. And here we have a brief Who Are Urban Indians clip, which we'll have Justine play for us.
When you think of American Indians and Alaska Natives, do you picture this? Over 70% of American Indians and Alaska Natives live in cities or suburbs. Starting in the 19th century, federal Indian boarding schools governed by the doctrine, kill the Indian, save the man, took children away from their tribes and families, and the relocation era in the 1950s forced American Indians off reservations. Wait, so most American Indians and Alaska Natives live in cities? Do they all have the same culture and religion? Actually, there are 574 unique federally recognized tribal nations around the country, and many other organized groups, tribes, and bands centered in both rural and urban areas. And with more Native Americans living in cities than ever, urban Indians continue to celebrate their cultures and traditions. To learn more about how urban Indians are staying resilient and what you can do to get involved, follow the National Council of Urban Indian Health on social media.
Thank you, Justine. This is NCUI's core Project Firstline team. Our public health program manager is Evelina Maho. Our senior project manager is Dionne Apedjihoun. And lastly, we have myself, who is the public health project assistant. Next slide, please. Project Firstline is a CDC national training collaborative for healthcare infection prevention and control. The collaborative has over 75 partners and is designed to help every frontline healthcare worker gain knowledge and confidence on infection control training. Next slide, please. Through Project Firstline, NCUI aims to strengthen the infection control capacity of the UIO workforce by identifying UIOs as champions to pilot test our training modules and modalities, the platform specific to the UIO workforce, and implementing the grant initiatives. Next slide, please. During year one, the Project Firstline initiative focused on strengthening public health systems and services through national partnerships. During year two, the initiative will focus on improving clinical and public health outcomes through national partnerships to prevent and control emerging and re-emerging infectious disease threats. Next slide, please. Recipients should be prepared to commit between 15 and 20 hours per week to conduct an individual project of their design, as well as general activities in support of the project, including working with NCUIH, UIOs, and other external stakeholders in a professional setting. Recipients will work remotely from their own self-designated location and are required to have their own personal computer, telephone, high-speed internet access, designated office space, and other technology required to maintain a professional virtual office setting. Fellows will identify their desired work timeline in their application from a minimum of 3 to a maximum of 10 months. Fellowships must be concluded by September 29th, 2022. Next slide, please. Fellows will assist NCUIH staff and subject matter experts in the following: the development of cultural appropriate activities, the development and promotion of webinars, podcasts, and Project Echo, liaise with the project evaluation team to aggregate evaluation surveys responses from UIO participants, provide support to the champions in meeting all core requirements for UIO IPC system champions, providing feedback on overall process and experience, participate in Project Firstline events in the NCUIH's annual conference, and support any other task assigned within the scope of the project and the Fellows University standards. Next slide, please. To be eligible, you must be enrolled in the 2021-2022 academic year as an undergraduate or graduate at the time of the application. You must be a member of a federally recognized tribe or Alaska Native village. You must be an undergraduate applicant. Undergraduate applicants must have a minimum of a 3.0 GPA on a 4.0 scale, and graduate applicants must have a minimum of a 3.25 GPA on a 4.0 scale. You must intend to serve an AIAN people as a professional through your chosen discipline, and you must submit a completed application. Next slide, please. The application package will have 5 parts, which include the applicant information form, your resume, a writing sample, references with letters, and a signed acknowledgement. Next slide, please. As far as selection criteria, incomplete applications will not be reviewed. We will also consider the overall impact of the proposed project and its relevance to the Project Firstline objectives, a willingness to participate exemplified in the application, a commitment to complete the core sets of required activities, and we would choose the top 2 applicants. Next slide, please. These are the key dates for the fellowship application. Applications are due December 22nd, and you should receive your application status by January 3rd. And if selected, your estimated start date will be January 11th. Next slide, please. Please email the address provided if you have any questions about completing the application. You can submit your application at the link below, and you can directly access the application by using the QR code on the slide. And I will open the floor up for any questions that anyone may have. And feel free to type your questions in the chat box as well, and we will answer promptly. All right, I think we can move on to the next slide, Justine. Here we have our frequently asked questions. How many NCUIH Project Firstline Fellows will there be? We will select 2 fellows, and funding will vary depending upon the preferred duration identified by each fellow in their application. Question number 2, I am not a public health student. Can I still apply? Yes, students from any background are welcome to apply. Nursing, medical, behavioral health, etc., as long as the student's work relates to the areas of the following: infection prevention and control, mental health, behavioral health, health communications, improving health processes, improving health quality, or any other related area. Question 3, my application is late. Can I still apply? No, all applications, including letters of recommendations, must be submitted before the deadline unless there are extenuating circumstances. Please contact ipc@ncui.org to set up a meeting to discuss. Question 4, when will I know if I'm a finalist and when will my interview occur? Finalists will be selected prior to January 3rd, and then they will participate in an interview with NCUI staff. And question 5, will interviews be in person or online? All interviews will be conducted via Zoom. Next slide, please. And on this slide, we also have the links to our other applications such as champions, fellows, trainers, and guest speakers. Next slide, please. And thank you for taking your time out of your schedule to join us today. And we hope that you consider to be a NCUI Project Firstline Fellow. Thank you. And I think we did have one question in the chat. We had 2. Can fellows call in or write with questions? I would say that you can email the ipc@ncui.org and we will answer any questions that you may have. You will be more than likely speaking to myself or Dionne and any questions that you may have about the application or the process, or if you may have a late submission coming through, we can definitely work with you and discuss it further.
Thanks, Aliyah. Apedjihoun. I just wanted to add to what Aliyah was sharing. Last year, we did have a fellow who joined us who wanted to submit her work as a part of her practicum. While we're not able to supervise this process, she worked with an external supervisor and submitted her activities with Project Firstline to her supervisor so that she could get credit for her work. So we'll definitely work with you if you're able to find a supervisor that will supervise your work. And then you can get credit for the amount of work that you're doing. Thanks, Aliyah.
No problem.
There are no additional questions. Thank you so much for your time. We will make this video available for others who'd like to view this, and we'll await your application, and good luck.